This is from 2015. Violent self-harm and suicide common among trafficked children. I'm just wondering, because I have a video right now that I just put up, and of course in my channel, brand new channel, already suppressing me because I call out my very nursing profession at the top. Because I'm doing the right thing and this world doesn't like it. Let me show you some statistics. Suicide rates increased 37% between 2000 and 2018 and decreased 5% between 2018 through 2020. However, rates nearly returned to their peak in 2021. Let me break it down even more. Suicide deaths in the United States overall by selected demographics for 2021 and 2022. Let me give a closer up view of the actual ethnicities. Do you see where the highest is? It's right below me. Whites. So my nursing, medical, and hospital associations in 2020, everybody knows this by now, I believe. Well, they decided, in the middle of COVID, all because of George Floyd, who died of a fentanyl overdose, to say that there's a systemic racism problem, which was key for them. They all needed to do it because, again, they aligned with the 17 Unsustainable Development Goals at the United Nations. That's who they answer to. The American Nurses Association, American Medical. Yet they never once wanted to focus on what the true pandemic was back then, which was trafficking. The worst thing ever. But they decided, we're having a racial reckoning, American Nurses Association said. We're going to reckon our racist ways, our racist history. And then they headed down there. It's a systemic racism was the public health crisis. So has the reckoning, have enough whites died? I'm just wondering. Has the reckoning been enough for you now that maybe you can put the focus on the pandemic of trafficking of young women and children? No, of course not, right? Can't do that because, again, there's those organizations at the UN that are directly responsible for trafficking at our open border. And, of course, the nursing profession and the nursing unions supported open borders. They did 4 or 5 years ago because they were on board with the UN. So there's even more trafficking. So this is why we have a more increased suicide rate. But my real question here, well, the people of big tech want to silence me, who's trying to speak up, say the right thing, right? That's how messed up this world is. Silence me for speaking the truth. Look at this number. That's 2021, 2022. 36,000, 37,000. So have enough, and then you can see here, Black or African American. I'm just wondering, American Nurses Association, hospitals, so because of your systemic racism being the public health crisis, has enough whites died for you, for your reckoning to be completed now? Or do you need more before you'll decide, let's do the right thing? In 2021, 48,180 people died by suicide in the United States. That is one death every 11 minutes. So in 2021, 36,000 whites died. In 2022, 37,000. And yet for the past 3 years, since 2020, the healthcare system decided to go on this a systemic racism problem in this country because they are so politically driven. And yet all these numbers increase, and the whole time they write papers about trafficking, but do they educate the nurses in this country? That's why my other video is being suppressed. Because I showed how just in the last couple of days there's been all these victims, these news articles of the communities in these counties where they found out there was all this trafficking going on. They're shocked because they don't know about it. Yeah, you don't know about it because part of the education that usually happens when we have an ethical medical system or the people dictating the standard of care is what will happen is nurses will know about that, then they educate other people. Okay? There's no education on this. But there'll be education on racial equity and systemic racism. I'm just wondering how many whites will have to die for, the professional organizations to be happy that, now we can say there's no longer a systemic racism problem. How long is that public health crisis going to go on? American Hospital and Medical and Nursing Associations. Yeah, because they haven't called an end to it. And this was 2019, one of many. Sex trafficking victim, 15, commits suicide. After return to family, we got her back damaged. What people don't understand about this, and I had to educate myself on it because I took care of many of these women, these young women, is that many times the reason that Trump had put these faith-based safe homes in different areas, because one is in my county, is because it helps them transition back, and they're in a home with other people, and it's faith-based. So that's good because then the medical profession, not coming in trying to control it since they don't even know how to put the most, the most crisis things first. But anyway, many of these young women, because that's the only life they've known, is they end up wanting to go back to their pimp. And they were never wanting to be pimped out. They could have been grabbed when they were a child, and then they're passed around to 20, 50 johns a day. That's all the life they know is being a piece of meat. The traumas are extreme. And a girl that was only 22, 23, the day before Thanksgiving, jumped out of a moving van on I-90 in Illinois into oncoming traffic and died. Just opened the door and jumped out. But the Medical, Hospital, and Nursing Association said they're, instead of focusing on all those traumas, all this, that's still a pandemic right now, that they never want to admit it's a pandemic, but they had the audacity to say that systemic racism is the crisis, the number one public health crisis. I still have the letter from every Chicagoland and suburb hospital that sent a letter to every volunteer, every employee at all their hospitals saying we stand with Black Lives Matter. I'm just wondering, is there a certain number of whites that need to die, American Nurses Association, and then you can say, okay, our reckoning is done. We can now say the systemic public health crisis is over. I'm just wondering. You big tech agencies, you can keep silencing me all you want. But all you people involved in trying to suppress people like me, that's just trying to speak up to the truth, that's trying to hold my own profession at the top accountable to doing the right thing, even if you get everything you want in this world, if you get your digital health ID and health equity plan in this country and are successful, well, eventually you all do have to eventually answer to the ultimate judge. Even if you don't believe in that judge, you'll have to answer to him. You may want to think about that because, quite frankly, I don't know how any of you sleep at night.